37 minutes after the hour of 6 o'clock, welcome back to the Now Morning Show. Now, there will be a health fair hosted by the MP for Diego Martin Central, Prime Minister Dr. Keith Rowley, in partnership with the Seventh Day Adventist Church in Carenage at the Carenage Boys Primary School this Sunday. Joining us to talk more about it are medical practitioners, Dr. Marissa Nimrod and Dr. Diamond Gill. Doctors, good morning. Thank you so much for joining us.
Good morning. Thank you.
Dr. Gill, I'm coming to you first. We're having this health fair. We just had a conversation about mental health as well. So there seems to be a lot of these health fairs popping up at different points in the country. Tell us about the objectives of this particular one.
Okay, good morning, everyone. Good morning, Trinidad and Tobago. Thank you, Kimberly. Well, on Sunday, Carenage, residents of Carenage, we are coming to you with a grand health fair. Kimberly would have mentioned it's being hosted by the Honorable Dr. Keith Rowley and the Carenage Seventh Day Adventist Church. Now, in this health fair, we aim to increase the awareness of, health screens for residents in Carenage. We want them to be more conscious of, self-care practices. We want them to be more conscious of making positive health changes. And so, when we visit you on Sunday, we'd be providing many services for you.
Tell us about some of the services.
High blood pressure screening, diabetes screening, and education as well. I know a lot of people are very interested in dental screening as well as hearing screening. We'd be offering vaccines. We'd be offering, various blood tests. We'd be offering other services like diabetic vein and education, testing, and the list goes on and on. I could also mention Pap smears for women, PSA for men, prostate exams, that is, for men. Yes. We have lung capacity tests. We have a cardiologist would be there. And don't forget, our doctors would be on site. If you need consultation, our doctors are there to help.
Yeah, and that I think is one of the most important things.
Yes.
I'm coming to you, Dr. Nimrod, because I'm wondering about the importance of the residents of the community coming out to this health fair.
Okay, so we're trying to make it accessible. So I think most of the times the concept is actually lack of access, timing, convenience. So in terms of the vision, I guess, which is in keeping with the national vision, is to allow for access and coming to meet the persons in the community. So if it's going to be on a weekend when it's probably less in terms of your commitments, responsibilities, then you can find the time to come and at least engage. So as Dr. Gill was saying, I mean, there's multiple services, vision screening, the whole yard. So if it is that you normally would have to take probably 2 or 3 days via appointments to get things done, it's going to be the entire caravan that's going to be there, again, trying to improve access and convenience. We're really hoping that the residents will take advantage of the opportunity. Free is always a good word in Trinidad and Tobago.
Always, yes.
So I think, that's also part of it. And also helping them to empower and take charge. Because a lot of times, you're always so busy. You will always be busy. You will always be busy. So when we give you the opportunity and we put it in your hands, then it's time for you to take charge and try to control your destiny, which obviously is your overall health and your quality of life.
Yeah. Dr. Gill mentioned 2 important Ps. I want to talk about one of the Ps with you, prostate, that PSA. How important is it for men to check their prostate? And additionally, what ages? Because I know some people are confused. Am I too young? Am I too old? So at what age should men, come out or even come out on Sunday to check their prostate health?
Okay, so according to at least there's international screening guidelines, but even for Trinidad and Tobago, men who are at average risk, so we're looking for men who are going to live 10 years, right? We normally look 5 to 10 years. We normally start at 50, right? So ideally 50 years would be my starting point for men in general who have a low to average risk. For men who are actually at high risk, we bring it down to 45 because we've noticed for the statistics in the Caribbean that there are more men presenting at younger ages. And if you have at least 1 or 2 relatives, whether it's a father, an uncle, or a brother, who may have been diagnosed with prostate cancer from your family history, then we drop the bar even lower and we start screening at 40 years, right? So ideally that would be what we're looking for in terms of patients. So ideally we say 40 to 45 is where we begin. The PSA, which is a prostatic-specific antigen test, it's actually an enzyme that can be found from the prostate gland. It's secreted normally to help for the viability of the sperm, but we can use this particular blood test to assess for men who may be at risk. Some men don't know their numbers, and that's up. So even though the guidelines have changed a bit, where we don't just refer to that alone, we use it in tandem with the test that most men run away from. So the digital rectal exam or the finger test will check to see what the prostate feels like, because anatomically where it's located, it's just right there by the rectum. So when we put a finger, we can feel that particular zone, if it's swollen, if there's a bump or nodule, you know. So again, that helps us to get a feel in addition to the blood test. So the blood test alone is not the diagnostic part of it. It can help in terms of screening.
Yes.
So screening is when you're looking for an abnormality in an otherwise healthy patient with no signs and symptoms. So that is really the thinking behind it. And then subsequent to that, whether it's every 3 to 5 years, depending on the risk of the patient, after we have that discussion, because every patient is different.
It's different, yeah. And I'm coming to you, Dr. Gill, for that second P. Of course, it relates to all women, the pap smear.
Yes.
The importance of it. And of course, it's going to be available on Sunday.
It will be available, correct, Kimberly? But unlike the men, we advise women at the age of 21, as early as 21.
As early as 21.
Yes, you can get your pap smear screens done, and every 3 years, we advise women to repeat that test. And once it's normal, between the age of 21 to 30, just keep visiting your health practitioner, your doctor, to make sure that it's normal. Once you pass 30 years old, we also advise that, in addition to the pap smear, you also have HPV testing done, because HPV also can cause cancers of the cervix, and realize that cervical cancer is the leading cause of cancers in Latin America and Caribbean women, all right? So we're encouraging women to come out, have your pap smear done. It's just a simple blood, not a blood test. It's a test where we take a little bit of, cells, a swab from the cervix, and we send it to the lab. All right. And
now, what are we looking for? And in the test, are we looking for those cancerous cells that are popping up, or anything else that you may find abnormal when that test is done?
Well, it's a screening test for abnormal cells, pre-cancer cells, we call it. All right. So the earlier we detect it, the earlier we can treat it.
Right. Yeah, interesting. I'm coming back to you, Dr. Nimrod, because I know, as Dr. Gill rightly mentioned, it's different for women. At a young age, you're accustomed to going in for your pap smears and that sort of thing. But remember, when you're testing for the prostate cancer, it's different, right? And men may feel a sense of apprehension when they have to get that prostate check done. Any words of advice for members of the male community to sort of put them at ease, and for them to see the importance of getting their prostate checked, especially those who are at a high risk?
So culturally, men love to be in charge. That's probably how I have that discussion in terms of keeping it real with my men. So you really want to be in charge of your destiny. Prostate cancer affects everything, mental health, sexual function. There's so many things. So I would say, don't give yourself the opportunity, unfortunately, to fall on the other side of good health. It's literally just a few seconds. We go in, we talk you through it. I know there's a sense of, as you said, apprehension, but again, without men, we don't have a full or true community, and we need them. That would be my take-home point in terms of reaching out to that family, community sense of responsibility. So you belong to a community. You are the person who will be providing and helping keep things together. It's just one simple, quick event for us to reduce that risk of anything happening to you, because at the end of the day, we need our men.
Exactly. And we're going to pause it there for now. But before we go, Dr. Gill, just remind us where it's taking place, when it's taking place, and what time.
All right. So this is the Grand Health Fair at Carenage this Sunday, the 1st of October 2023. And we'll be hosting this event at the Carenage Boys Government Primary School. The time, 9 a.m. to 3 p.m. And if you want any further information, you can call 633-5142 or 633-3960.
Nice. Well, let me thank you so much, doctors, for coming in this morning.
Welcome.
Dr. Gill, Dr. Nimrod, thank you so much for joining us, and all the best with the health fair on Sunday.
Thank you.
Thank you very much.
Have a good day.
And of course, that was Dr. Diamond Gill and Dr. Marissa Nimrod just telling us about a very important health fair that's coming up this Sunday that you don't want to miss. You're on the Now Morning Show. We're going to take a break and be right back. Stay with us.
And without social unrest,